My name is Jennifer Corbin. I'm the Cardiac Performance Improvement Specialist in the cath lab. So I've always known what I wanted to be. From the time I was literally 5 or 6 years old, I knew I wanted to be a nurse, and specifically actually a cardiac nurse. I think in being a nurse for over 20 years, anybody who's been a nurse that long is going to have quite a few skills that they've learned along the way. I really feel like my greatest skill is my passion. I've been passionate from the time I started. I was passionate at the bedside, taking care of the patients and trying to figure out everything that was wrong with them and help them. I continue just to still be just as passionate now today in the work that I do, just always trying to provide evidence-based care to these patients, and I've always been passionate. I've always been a very proud nurse. I've been proud since the day I really became a nurse. Since 20 years later, I'm just as proud as the day I started. It's a small community, right? And so this is when I was working in the cath lab, and there was a STEMI, which is someone's having a heart attack, and arriving into the ER, I walked into the patient room, and of course it was someone that I knew. It was a friend and the family, and I knew them very well, and it was a very scary time for them. But the second I seemed to have walked in, I just saw the look on their faces, like, oh, okay, she's here, she's going to be able to take care of us. And then we get into the cath lab, and I was able to reassure this gentleman, and he actually was very sick, and he was having horrible chest pain, and he was nauseated. That's just the normal kind of severe symptoms that you can get with the heart attack. The great thing about this is to witness. It was one of those instantaneous changes in a patient's symptoms, I would say. As soon as we got that vessel opened, it was instantaneous. His chest pain went away. His color actually pinked up, and he wasn't nauseated anymore. And that usually doesn't happen that quickly. And it's just the whole process. So after the case was over, I accompanied the cardiologist to talk to the family, and just being there. And doctors can talk to patients, and sometimes they don't fully understand what's going on still. But it was just nice that I got to be there with this family and really tell them and talk to them about what happened. And even to this day, I am in the community, and I'll see them, and I'll see him or the family, and it's just this instant hug. It's this instant, we know what happened, and it's lovely. There's so many stories. There's so many stories like that. It's a small community, and we're gonna run into people that we know, and it's just nice when you're in your worst. It is just very nice when someone's at their worst, that you could be there and make it better for them. I do want to mention how I strongly feel that this hospital has always given hope to the community and to our patients. Even during the worst pandemic that we've ever been through, we were able to get our second cardiac accreditation through the ACC. So currently we are now chest pain center accredited, as well as cath lab accredited from the ACC. We could not have done this without the backing of the hospital. We could not have done it without ER support, cath lab support, CVICU support, lab. Every part of this hospital came together. It's such a momentous and wonderful thing that just doesn't happen all the time.